Hi, good evening, everyone. Welcome back to the part two video of NORCET-9 mains paper analysis. In part one, we almost all we nearly covered 85 questions in my part one video. If you didn't watch part one, please go through part one video. Then you come to the part two video of NORCET 2 paper analysis, main paper analysis. Uh, like let's continue from the first question of this session. Here we are having a patient taking a isoniazid. Okay, it comes under the drug. Okay, it's tablets. Okay, it's a tablet taken for TB. Okay, especially TB under RNDCP program So we are having FDA. Okay, FDA combined drugs protocol is there. Okay, FDA approved combined combination of drugs we are taking that are HRZD. Okay, that are HRZD. Isoniazid, rifampicin, pyrazinamide, ethamide. Okay, these four are the combination of drugs provided by RMPTC. Okay, here they are asking you if the patient is taking a isoniazid for the active TB, and the nurse knows the side effect of this isoniazid is peripheral neuritis. So he will, okay, as a nursing officer, he will instruct the patient. Okay, patient taking. Okay, patient taking. Sorry, here question is incomplete. Here, patient is taking a isoniazid tablet. Okay, so what is the what is the instruction to be given for the patient? So means, as being a nursing officer, if the patient is on isoniazid, what he will instruct the patient to take other extra tablets. So here are the examples. Okay, here are the MCQs. Option number A, vitamin B6. Option number B, vitamin B12. Option number C, vitamin B1. Option number D, vitamin A. If you see optic neuritis, okay, optic neuritis or peripheral neuritis, okay, these are the most common side effects. Has been most common side effect of isoniazid. If the patient is on isoniazid, they are prone to get the peripheral neuritis. So to prevent that side effect of the TB, what will give? Will give vitamin 6. Okay, will give pyridoxine tablet because it will helps in regeneration. Okay, regeneration of peripheral nerves. Okay, peripheral nerves, and it reduces the inflammation. Okay, it reduces the inflammation of the nerves. That's why we're going to choose the pyridoxine as to prevent the side effect of isoniazid, that is your optic neuritis or peripheral neuritis. Okay, both you can prevent it by giving the tablet of pyridoxine 6 mg. Okay, remember the dose also. Okay, this time they ask you the pyridoxine. That next time they may ask you the dose of pyridoxine. Okay, dose of pyridoxine. How much will give? 6 mg pyridoxine. Okay, 6 mg pyridoxine BD we can give if the patient is taking on isoniazid. So next one, 85th question. Here after BCG vaccine administration, after how many weeks should the vaccine site to be checked for take response? Okay, here the examiner is asking you, okay, not a routine question here. Like if you see, if the examiner is asking you what is the scheduled, okay, what is scheduled immunization schedule for BCG vaccine, when it's administered, how it is reconstituted. This and all if they ask means you can able to easily answer. Here they given you high, okay, they escalated the topic, they increase the level of knowledge, to assess your level of knowledge, they given you some higher question. Here they're asking you take response. Okay, what do you mean by take response means? What is the take response means? If this vaccine is given to your left arm, okay, your left arm, that is your deltoid region, the given means, okay, usually it will be given through intradermal route. If we see this one, okay, after what will happen? After there will be bleb formation. Okay, after there will be a bleb formation. Okay, redness, pus will be there. So after that, what will it will go? Finally it will become turned to healed. Okay, healed ulcer or scar will be formed. Healed ulcer or scar will be formed. Okay, here the examiner is asking you what is the time duration taken for scar formation or ulcer formation. Here if you see means, so usually if you see means it will take for a take response, it will take around maximum 6 to 8 weeks. Okay, you should choose maximum time. Okay, if it is more than 2 months or more than 1 month, okay, up to 1 to 2 months you can take it as a how much duration it increase, that much the take response will be good. So your answer should be 6 to 8 weeks. Should always choose which one is more lengthier weeks, that one you can choose as an answer. Okay, 6 to 8 weeks is the so going to the next question. Here we are having next question, 86th question. How much the health insurance coverage under the Pradhan Mantri Ayushman Bharat Jan Yojana? Here, if you see PMJAY, okay, the name of the program is PMJAY, means Pradhan Mantri Jan Arogya Yojana. Okay, means under this program, how much per family? Okay, how much per family has been given as a health insurance amount? Here, they're asking you the what is the cash? Okay, what is the amount premium taken for the taken under the health insurance coverage by the PMJAY. Okay, is this one okay? If you read out about the national programs, you can able to easily answer. The 5 lakhs, okay, 5 lakhs amount to be covered for the per family. Okay, per family they will cover 5 lakh. Okay, per family package will be 5 lakhs under the PMJAY scheme. So next question, 87th question here. In a vaccine, okay, in a vaccine, adjuvants are added. Okay, adjuvants are added as like if you see magnesium sulfate, aluminum hydroxide. Okay, these are the some example for adjuvants. Okay, see here the examiner asking you what is the role of adjuvants. Okay, what is the role of adjuvants used in vaccines? So if you see option number A, to enhance the stability of the vaccine, no, will not add any magnesium or aluminum, any adjuvant to increase the stability of the vaccine. Will maintain the pH by buffers. Okay, by adding the buffers to maintain the vaccine stability, like phosphate buffer. Okay, these are added to increase the vaccine stability, not the adjuvant. Okay, adjuvant. Okay, here if you no, this one that is not answer B, to kill the pathogens in vaccine. No. Option C, to prevent the side effect of vaccine. No, because of this adjuvant there may be a chances of side effects. Okay, there is a chance of side effects. So option number D, if you means it enhances the immune response of the body. Okay, this is one is a right answer. Here, if you see adjuvants are added to increase because they will trigger your they will going to trigger your immune headquarters. Okay, so that's why it's going to increase the immune response of the body. So option number D is the right answer. So edit question. Here, this one also question came from like national programs of India. Here the question is which of the following program is related to reduction of maternal and newborn mortality rate? Okay, by increasing the institutional deliveries. Means here they are okay. They are asking you what is the target? Okay, what is the target if you're reducing the maternal and newborn mortality rate by increasing the institutional delivery? Okay, what is the this goal is of which program? Okay, here they are asking you here, this goal is of which program, which national program will target the maternal and newborn mortality rate. Okay, if you see your JSY, okay, Janani Suraksha Yojana, which target, okay, this target the maternal and newborn mortality rate. Okay, mortality rate reduction. How means it increase the transportation facility, like who is conceived, whose mother is like in a remote areas and all means it increase the okay remote it increase the mobility. Okay, it increase the mobility of the pregnant women from the remote villages to institution deliveries, and it increase the like it gives the ashas to incentive to increase the institutional deliveries to increase the institution deliveries, and it helps in diagnosis and checking their urine routine checkup and all in a PSC they facilitate. So under JSY, okay, it increase the institutional delivery by reducing the maternal and newborn mortality rate. So option number B is the right answer. So here, if you see means 89 question, here they're asking you which among the following given has a highest protein content. If you see like per 100 gram, okay, per 100 gram soybean contains 36 gram of 36 gram of protein. If you see per 100 gram of egg, it contains 6.6 gram, okay, 6.6 gram of protein with egg, okay, with yolk. Without a 6 gram only it contain. Okay, only white. Okay, egg white will contain only 6 gram of protein. If you see 10 gram of pulses will contain only 5 gram of protein. Okay, if you see 100 gram of milk will contain 100 ml of milk will contain 3.2 gram of protein. So among this one, soybean is the highest amount of protein will be given per 100 gram. So soybean will be a right answer. So 19th question here, the following program is objecting towards the family planning and reproductive health. Here PPC means both, okay, both family planning and reproductive health has been focusing as the goal of RMNCA plus RMNCH plus A plus A means adolescent health. This under this program, this both okay family planning and reproductive health has been targeted here. RMNCS expansion means reproductive, maternal, newborn, child plus adolescent health. 91 question, which among the following major constituent polluted water in India? Okay, here they're asking you Which among the following given as a major contributor? Okay, major contributor for pollution of water pollution in India. Okay, here they asking you what is the like most common, okay, most common major component of polluted water in the India. Okay, specifically they mentioned India. Okay, India. Here if you see particulate matter will be contributor for air pollution, and sulfur dioxide also a contributor of air pollution. Carbon dioxide, carbon monoxide both are a contributor of air pollution. If you eliminate the three option, you can easily answer option number D is the right answer. Okay, especially stool. Okay, fecal contamination is major contributor of water pollution in India. Okay, fecal contamination is highest contributor. Okay, it's contributing more for the water pollution. So option number D is the right answer. 92 question. Okay, here if you see which of the following disease cannot be prevented by herd immunity. Here, what do you mean by herd immunity? Immunity nothing but it is a immune. Okay, it is an inbuilt immune response of response of larger population. Okay, larger population peoples. This called as herd immunity. Okay, means which among the following cannot be prevented by the herd immunity they are asking you. Here if you see means tetanus is the tetanus is the infection, okay, disease which cannot be prevented by the herd immunity. If because why? Because if you see means the tetanus will spread mainly through blood route. Okay, blood route means when you are having an open wound, okay, open wound and contaminated with the soiled or rusted particle, will get the tetanus because clostridium tetanus spores will be active in like a soil and the rusted particles. So if you see this one is not at all related to any like community of the immunity, like community of the immunity, it's not at all related. You see measles, polio, chickenpox, both are the highly communicable disorder. Okay, highly communicable diseases. Okay, if you give vaccines, you can able to achieve herd immunity. Okay, you can able to achieve the herd immunity, but tetanus cannot give the herd immunity. So moving to the second question. Okay, this already dealt in first part number one. So question number 93, here we are having the which among the following is true regarding the herd immunity. Here the examiner is asking you which among the following is true regarding the herd immunity. I told you what is the definition of herd immunity. Here if you see, here the examiner is asking you what is the correct statement given following options. Okay, about the herd immunity. Here option number A, immunity developed in individual. Okay, in individual after the natural infection only. No, it is not the right answer because I told you at a larger population, it should cover the larger population. Here, this option is talking about the individual immunity. Here, if you see option will be protection of population from the disease when a larger portion is immune. I told you in a like last MCQ only. If the population, okay, if the given larger population of people is immune to particular disease, we call that one as herd immunity. So option B is the right answer. 94th question. Country, okay, here they asked you like demographic question from community demographic question is there. The country population pyramid, okay, population pyramid shows a triangle shape with the narrow top, okay, here the narrow top and wide bottom, okay, and the wide bottom, okay. Here which of the characters will be best describe the demographic pattern. Okay, here they're asking you which pyramid is looks like. So if you see low birth rate, option number B, a high elderly population, option number C, high birth rate with the larger young population it indicating. Okay, if here if you see high birth rate, okay, high birth rate at the base and at the younger population, the constant younger population. That will be your population pyramid in a demography. Next question, 95th question. Here, so this question is repeated. Okay, if you see next question, which means following statement is correct regarding the killed vaccine. Okay, killed vaccine or inactivated vaccine. Here, if you see, so there are so many vaccines are there, types of vaccines are there. If we see like live vaccines we are having, killed vaccines we are having, and polysaccharide vaccine we are having, and conjugate vaccine we are having. There are so many types of vaccines are available. There are so many types of vaccines are available in that if you see live vaccines and killer vaccines, so many vaccines are available. Here they're asking you. So moving to the next question. 97th question here in front of you. Which among the following maneuver is used during normal vaginal? Okay, normal vaginal delivery for like normal vaginal delivery. So you just cut this assisted delivery. Assisted delivery of the fetal head. Okay, here they're asking you like which of the among the given maneuver used for normal vaginal delivery for the fetal head. Here options are in front of you: a bird Marshall maneuver, a Ritson maneuver, McRobot maneuver, Chrysler maneuver. Okay, if you see for normal delivery we'll use a Ritson maneuver. Okay, here how means by extending the by extension of fetal head. Okay, fetal head and taking up forward pushing toward the forwarding of the fetal head. Okay, by this maneuver, okay, by this technique, we're going to take the we'll lift the okay, we'll extend the head of the baby and we'll take the forward to the whole body of the babies. Okay, that is what your Ritson maneuver. Okay, this one is used for normal vaginal delivery. Okay, this burn Marshall, Mac Robert, Chrysler maneuver. This all three are used for shoulder dystocia. Okay, shoulder dystocia will use the Mac Robert and burn Marshall maneuvers. Next question here, 98 question. Which among the following is normal preductal, preductal oxygen saturation SpO2 in a full-term newborn at the 1 minute. Okay, at the 1 minute you should focus on 1 minute. Okay, after the birth. Here if you see means 60 to 85% is the right answer. Okay, if you see patient the baby's neonatal SpO2 will be at the birth. Okay, after birth 1 minute it will be around 60 to 65 percentage. If you see like if they ask you okay after 10 minutes of birth, okay, after 10 minutes of birth means you should answer it as 85 to 90 percentage. Okay, at 1 minute of birth fetal, okay, the newborn SpO2 will be 60 to 65 percentage. So the option number A is the right answer. Next question. Here we are having a 28-year-old primary gravida at 30 weeks of a period of gestation comes to labor room with the complaints of headache, blood vision, and edema in the hands and leg. Okay, on examination, her blood pressure is 160 by 100 mmHg and urine output, urine dipstick shows +3. Okay, +3 proteinuria. And what is the most likely diagnosis? Here, the examiner asking you diagnose the case. They given you scenario, they given you the like complaints, they given you the examination findings, assessment findings, and they're asking you what is the likely diagnosis, most favorable diagnosis. Here, if you see means here we are having the complaints of symptoms of headache and blurred vision and edema. This all are indicating of end organ damage is present. End organ damage is present. And if you see, okay, on examination, BPC is elevated. Okay, BP is elevated 160 by 100 mm of Hg. And an investigation, if you see, means they done a protein. Okay, protein check in urine. Proteinuria is present +3, that is +3. So all these three are denoting preeclampsia picture. Okay, preeclampsia picture is clearly visible on the based on findings, based on symptoms, based on the investigation findings. So our answer will be a preeclampsia. Okay, preeclampsia is the right answer. We see eclampsia, the major difference between the eclampsia and preeclampsia is seizure. If these three all symptoms are present, along with if they given a seizure means you should answer it as eclampsia. But here in the option they're not given any seizure episode, so your answer will be always goes to preeclampsia. All of you clear about this preeclampsia and eclampsia? And next we'll move towards the 100 questions. Here we are having a 35-year primipara pregnant woman is at the risk of which malignancy? Here if the exam is asking you primiparous woman is there. Okay, primipara pregnant woman is there. Okay, like who is which among the following malignancies is most commonly seen in case of primipara or primigravida female? Here if you see like most probably your estrogen, okay, estrogen is if how much amount of estrogen will expose, that much amount of breast cancer risk will be there. That much amount of breast cancer risk will be there. If we see means the primipara, okay, those the pregnant will not be conceived, they'll be elevated. Okay, they'll be more exposed to the estrogen because if we see pregnancy is an progesterone predominant state. Okay, in pregnancy there will be a increased amount of progesterone. So there will be a less amount of estrogen. See, around 9 months there will be a conceived period. So along on like till 9 months they will not be having any exposure of like estrogen. So that's why primiparous women are more prone to get the breast cancer. So option number A is the right answer. Next question, or not one. Here, which among the following true regarding, okay, is the true regarding fetal circulation ductus venosus. Here we are having a, if we see fetal circulation, then we are having the two connections, okay, ductus arteriosus and ductus venosus. Two connections are there, and there will be a like, connection between the right atrium and right ventricle. That is your like ductus foramina. So if you see means okay, what is true regarding here? The examiner is asking you what is true regarding ductus venosus. Ductus venosus means connection between the two veins. Okay, here this meaning is ductus venosus is nothing but connection between the two veins. Okay, connection between the two veins is called as ductus venosus. Okay, now we'll see which that are two veins. Okay, what are the two veins are exactly? Here, if you see means ductus arteriosus connection between the right atrium and right left heart. No, it's not right answer. If you see, we have to search for the two veins here. Okay, here if you see option number B, ductus arteriosus. Okay, sorry. Actually, this one. Okay, you can. This MCQ is like 1 minute. Option number B. Okay, I'm little bit. I'm modifying it. Okay, ductus venosus. Okay, here if you see now you can see ductus venosus is a connection between the umbilical vein and inferior vena cava. Okay, if you see here, this one is the inferior vena cava. Here there will be a placenta. Here there will be umbilical vein going on. So it will connect to inferior vena cava. So that's what your this connection is called as ductus venosus. And again it will go to your liver and then go to portal circulation. Then it will go to again it will go to like reach to inferior vena cava only. That's what we were called as ductus venosus. Option number B is the right answer. This question is from pediatric. Okay, here we're having a 3 weeks old infant brought to the pediatric OPD with the complaints of projectile vomiting after the feeds. On assessment, finds olive-shaped mass on the abdomen. Okay, which among the following clinical findings most likely associated with the condition? Here the examiner asking you diagnose the case. Okay, here they are given you clinical features. Clinical features are given and assessment finding. Okay, and assessment findings are given. So based on clinical features and the assessment findings, you should give a probable diagnosis. Okay, diagnosis is the case here. If you see means here the projectile vomiting. Okay, projectile vomiting. Where there will be projectile vomiting, there must be obstruction. Okay, if there is an obstruction, we get forceful. Okay, forceful like high pressure volume of vomiters will be coming out. That's what we call as projectile vomiting. Okay, after feeds, when we'll get like this case means here examining finding is olive shaped mass. Okay, olive shaped mass is there in a visible on the abdomen. Okay, visible on the abdomen. If this one is stomach, okay, here at the end of the stomach there will be a obstruction. Okay, at the pylorus there will be obstruction. We call that one as hyperpyloric stenosis. Okay, HPS. Especially we'll call as congenital hyperpyloric stenosis. This is a condition we can able to see because there is a gastric outlet obstruction. Here at the outlet of the gastric stomach part, there is a mass sitting over the pylorus part, so that will be obstructing the pathway. Okay, food will not be gone to the lower GI tract, so that all the food, what all the feed, what all the milk, breast milk is the baby is taking, that will be forcefully ejaculated after the feeds. So this classical features seen in case of congenital hyperthyroid stenosis. So option number A is the right answer. Next question here they given you match the following. Okay, match the column A with the column B. Here match the following signs there with the corresponding condition. Match one radiological signs along with the diagnosis. If we see means double bubble sign seen in case of duodenal atresia. Single bubble sign seen in case of pyloric stenosis. So we'll keep on matching here one with the A and B. Okay, triple bubble sign seen in case of regional atresia. So 2B. So single bubble sign in case of 3C. Okay, fourth one multiple air filled levels 4D. So if in option if we are finding any matching this following, we can able to choose that answer as right answer. If you see like option number A, 1A, okay, 2B, 3C, 4D. Okay, so option number A is a right answer. Here, if you see like pyloric stenosis, I told you pyloric stenosis is a gastric, like pylorus part obstruction is there that we call as pyloric stenosis. Here, if you taken any X-ray, there will be bubble sign. Okay, single bubble sign in seen in case of X-rays. So option number like or not three question is I think like option number A is the right answer. Next one here also this is a match the following, but this one is from OBG. Okay, OBG question. Here if we see here we are having a column A with the like condition and column number B we have to match the following. Here episiotomy first if you see here I'm writing down here first episiotomy is surgical incision to enlarge the vaginal opening during the childbirth. Okay, during the childbirth. So one is right. Okay, episiotomy is definition is right. 1A and partograph. If you see partograph, like instrument or device used for tracing and copying. No, this one is actually partograph is graphical. Okay, here this one is question is written wrongly here. Partograph is representation of graphical representation of labor process. Is called as a partograph. Okay, 2B. Option 3, if you see purpurum is the period after the delivery is called as purpurum. So B is C. Option number D is question number D is crowning like occurs on the second scene of the labor. So four is D. So four options you look for the 1A, 2B, 3C, 4D. Okay, so option number A is the right answer. So if you're clear with the not fourth question, we'll move towards the next question. Sixth question here we are having the like best time to perform the HSG. HSG is nothing but hysterosalpingography. Okay, this one is done to check the tubal patency. Okay, fallopian tubal patency. They're going to perform the HSG. How they're going to perform? They'll put a Luke Wilson's cannula in a vaginal opening. So it will go to up to the uterus. So they will push a dye from the Luke Wilson's cannula, and they will see they will take the serial X-ray when they are pushing the dye. So they will see whether the dye is pouring out of the fallopian tube or not. That indicating if there is the dye is not coming out of the fallopian tube, there is the chance of tubal block. Okay, there is chance of tubal block. So to diagnose this tubal block or tubal infertility, they're going to perform the HSG. So here the examiner asking you, okay, best time to perform the HSG, okay, for assessing the infertility. If you see like most probably like day eight of the menstrual cycle, we prefer to do the HSG. Why, if you ask, means like day 5 to 7 it will be considered as bleeding phase. Okay, bleeding phase if you done means okay there is a no chance of any like infection or any retention of dye. So if you see why we are choosing a day eight as right answer means because it like if the woman is in bleeding phase, it indicating she's not fertile, she's not conceived. We are performing this one to assess the infertility. It's just like if you're doing the HSG at the day 14, what will happen? There will be chance of any implantation. Okay, there is a chance of any conceived. That time you're performing like HSG means they're going to remove they're going to cause the fetal loss. So to prevent that one, we are doing the like at the initial phase, at the bleeding phase, only going to perform the HSG. So option number A is the right answer. Day 8 of the menstrual cycle is best to perform the HSG. Next question. Here we are having the G1 P0 client. Okay, present to the PHC with the signs of postpartum hemorrhage. The nursing officer like initiate the emergency care, and what is the most appropriate first line management of this patient. Okay, here they're asking you what is the first line management of PPH. Okay, postpartum hemorrhage. Right, as like everybody knows, this one is a very like, easy answer. Perform uterine massage and administer the uterotonic drugs, that is oxytocin. By uterine contraction, there is a chance of bleeding loss. So option by A is the right answer. So moving to next question, 108 question. Here we're having in children's like blood pressure cuff should cover the what proportion of the arm circumference. If you see this one, like last question also, last NORCET data also, they asked you like what is the like width and the length of the be pick off. Here the right answer is 70 to 80% is our arm circumference it should cover. If it is more, it will give less like non-reliable values. If it is like width is less, it will give a falsely high values. So to prevent that one, we have to like make ensure the cuff should cover the 70 to 80% of arm circumference. So option number A is the right answer. So moving towards the next question. Here we're having a 3-year-old child. Child's fine motor development is to be assessed. Which of the following activities is the most appropriate? Here the examiner is asking you which among the given following activities will improve the fine motor activities of the child. Here options are in front of you. Here asking for the child to ride a bicycle, giving a child to play clay activities. Okay, clay activities and play to okay here draw. Okay, here draw the shapes like circle, triangle. Okay, that is a given option. Also, if we see like fine motor activities are like with your fingers, what you are doing that will improve your fine motor activities like writing, drawing. That all includes your fine motor activities. So option number B is the right answer. Okay, playing with the clay and drawing the pictures will improve the fine motor activities in the childrens. So option number B is the right answer. So next question. Here we are having a child diagnosed with the type 1 diabetes mellitus. Which among the following statement is true treatment of choice for the diabetes mellitus 1, type 1 diabetes mellitus 1. Here the examiner is asking you like what is the main course of treatment for type 1 diabetes mellitus. If you see we are having the diabetes, we are having type 1 and type 2. In type 1 if you see means there is a loss of okay, there is a destruction of beta cells of pancreas. In type 2 diabetes means there is a resistant. Okay, there is a resistance for insulins. Okay, your cells are resistant for insulin. So in type 2, we are having a like dietary modification, lifestyle modification that is a treatment of choice. In type 1, if you see, they are called as insulin dependent. Okay, in type 2 diabetes mellitus is called as insulin dependent because the beta cells cannot able to produce the any more insulin. So in the type 1, we always prefer to give the insulin because they are insulin dependent. Okay, type 1 diabetes mellitus is also called as juvenile diabetes. Juvenile diabetes. So always in type 1 diabetes mellitus, we prefer to give the insulin as a treatment of choice or a drug of choice. So next question here. Like here we are having a 1-year child present with the symptomatic hypocalcemia and pediatrician prescribes the intravenous IV calcium therapy. Which among the following methods like methods of administration should not be used for the calcium gluconate. If you see calcium IV calcium gluconate 10% they will be like prescribed means we should like, think okay calcium gluconate is life saving drug okay but it should not be given as fast IV. Okay, fast IV. If you give fast IV, what will happen? There will be a flushing reaction. So always okay, this should be avoided. Okay, fast IV or rapid bolus should be avoided. Okay, that should be avoided. So option number A is the right answer. Okay, if this is slow IV push over a several minutes, over 10 minutes is preferred like a route of administration of intravenous calcium. So option number A is the right answer. Here they given you image based question IBQ. IBQ from the OBG. Here if you see the shape of the drape, okay, you can able to see how it is. It is V shape. Okay, if you see here, there is a collection bag is there. Here on green drape is there. Okay, if you see later time position, we can give on patient. Like especially it indicative of like it's like a clinical picture. It indicative of there this in IBQ is used in the obstructive setup. Okay, if you see that one is obstructive V shape. Okay, obstructive V shape drape is the right answer. Next question. Here we are having a like what is the expected decline of total serum bilirubin level with the effective phototherapy? If you see like normal bilirubin will be 0.82, direct bilirubin will be 1.2 mg deciliter is a normal bilirubin. When there is a like increased bilirubin more than 1.2 mg deciliter, we call that one as jaundice. In case of if you see like neonates or neonates or infant, they are prone to have a neonatal jaundice. So neonatal jaundice, what will do? Will prefer the phototherapy. Okay, will prefer the phototherapy. Here the examiner is asking you, what is the like how will you confirm the phototherapy is effective or not? If we see daily per 4 to 6 hours there is a decline, okay, after the phototherapy, after the serial intervention of phototherapy. If there is 1 to 2 mg deciliter of like bilirubin is coming down for the coming declining for the 4 to 8 hours, that is the indicating of effective phototherapy. So option of B is the right answer. 1 to 2 mg deciliters for 4 to 6 hours. If there is a decline of bilirubin amount is there, we call that one as there is a effective phototherapy. So option of B is the right answer. So moving to the next question. During HSG, okay, here during HSG, okay, the physician has done a HSG means histosalpingography. After doing HSG, he confirmed there is a intrauterine adhesions consistent with the Asherman syndrome are identified. Okay, means after doing HSG, he found there is an adhesion present in uterine cavity. So he confirms that there is an Asherman syndrome. So, which clinical finding features is most characteristic of this condition? Here, the exam will ask you what is the clinical features of Asherman syndrome. Here, if you see means Asherman syndrome, what there will be there in uterus, there will be a so much adhesion. Okay, there will be a adhesions will be there. Adhesions will be there, and there will be a endometrial there will be an endometrial hypoplasia. Okay, there will be endometrial hypoplasia. Means the reduce there will be a atrophy. Okay, there will be atrophy of the endometrial tissue. Means the endometrium is like endometrium layer is getting destroyed. So to this all layers are okay. Endometrium layer is it's main most probably helps in your your bleeding phase. Okay, your shutdown of your endometrial wall. So if you see there is no like endometrial cells are there, means there is a chance of hypomenorrhea. Hypomenorrhea means less, okay, less than 30 ml of blood. Okay, less than 30 ml of blood is passing through passing to the uterine cavity. Okay, through vaginal cavity during the menstrual cycle, means we call that one as hypomenorrhea. Okay, the reduced flow of the blood. Okay, reduced menstrual flow is called as hypomenorrhea. Okay, this one is the most common symptoms characteristic feature of Asherman syndrome. So next question. When does the second stage of labor begins? Here this one is a very simple answer. Okay. If you see like a 10 centimeter cervix dilatation, it start with the full dilatation. Okay, full dilatation of cervix to the fetal delivery. Okay, fetal delivery it will end. So that is your second stage of labor. If you see means here there is a option number like when it begins. Here they ask you when it begins, not ends. So it start of the complete effacement of the cervix. It will start and end with the fetal delivery. So option number B is the right answer. So moving towards next question, 116 question. Here we're having a like 38-year pregnant woman found to have a tobacco juice colored amniotic fluid on ruptured membranes. What is the most probably likely the cause? Okay, so like if you see like 38 term woman came to like labor room, they found there is a tobacco juice, okay, colored amniotic fluid is coming after the rupture of the amniotic membrane. So that what is the likely cause? If you see causes, okay, if it is greenish, okay, if it is greenish, we call that one as MSL. MSL nothing but meconium stained labor. If it is a tobacco juice affair, we call that one as there is a intrauterine death. In case of intrauterine death, there is a chance of tobacco juice colored amniotic fluid. So option number A is the right answer. Next question. Here we're having a 40 weeks of gravida, like gravid woman, present with the cervical dilation of 6 centimeter and uterine contraction. For every 5 minutes, there is a one uterine contraction. So, what is the appropriate next intervention for done by the nursing officer? So here, administer oxytocin injection now no. Insert the like to begin pushing no. If you see like already, if you say like it caused the like sorry in first stage of labor there is a two phase. Okay, there is a two phase. One is like latent and active phase. So if it is more than 6 centimeter, we call that one as active phase. Okay, already labor has been initiated. Okay, already latent phase has been finished. It means we have to wait. Okay, we have to continue the monitoring the labor process and fetal status. So that is the right option, because if cervical dilation is not there, if they given you okay less than 1 centimeter, 1 centimeter dilation is there, and uterine contraction are less than like more than it's taking more than a 10 minutes one contraction is coming up means that time we have to administer the oxytocin and we have to induce the labor process. So that is not given in option like in the question. So like normal labor process happenings that time we have to monitor the labor progress and we have to do the fetal monitoring. That is your right option. Option number D is the right answer. So next question is here at the 40 weeks of gestation, like clinical pelvimetry has been performed. Which among the clinical findings suggestive of abnormal or contracted pelvis? Okay, abnormal or contracted pelvis. Here the examiner is asking you what are the clinical features of pelvimetry findings of contracted pelvis. Pelvimetry is nothing but assessment of pelvic diameters is called as pelvimetry. What do you mean by pelvimetry? Does anyone knows? Pelvimetry is nothing but assessment of pelvis diameter. Okay, pelvic diameters called as pelvimetry. Okay, if the fusion has been done pelvimetry. So, which among the clinical findings which suggests the abnormal or contracted pelvis? We see most probably in males if we see that there will be the ischial spine will be more prominent and it will be pointed to. Okay, they will be pointed, so we can able to easily palpate the ischial spine. But if you see females, the ischial spines are not pointed, they are blunted. So option number D, it clinically okay, it denotes that there is a contracted pelvis. So ischial spine easily palpable and prominent is a right answer. Okay, this is seen in case of male pelvis, not in a female pelvis. If this one is present, ischial spine are easily palpable means we call that one as contracted pelvis. So, like next question, in a partograph, which line crosses indicating need for immediate action or emergency intervention during the labor. If you see means on photograph there will be a two lines. Okay, action line, sorry, alert line and action line. These are two lines are present. Okay, alert line crosses means we call that one. We have to shift. Okay, with the time we have to shift the patient or we have to do some intervention for the patient. Okay, we have to refer the patient or we have to do some intervention after crossing alert line. So okay, after crossing action line, we should always do the emergency intervention. Okay, emergency intervention should be done after crossing the action line. So option number B is the right answer. Next question, we're having a like during third stage of labor, the nurse observes there is a cord prolapse. Sorry, this one is not third stage. This one is like second stage of labor. During second stage of labor, the nurse observes there is a cord prolapse. Okay, there is a cord prolapse. Which among the which maternal position is most appropriate to relieve the pressure on the cord? Okay, if you see this one is a vagina means if there is a cord, you can able to visible on the umbilical cord is visible on the vaginal outlet means if the fertilizer head will be compressing the umbilical cord. So to prevent that one, to relieve the compression on umbilical cord, the exam is here the exam is asking you which position is given in case of cord collapse. Here if you see if umbilical cord is prolapsing collapsing out and is compressed by the fetal head means we have to remove the compression. We have to take the fetal head away from the umbilical cord. If you give trundle and bug position, if you raise the foot end of the patient, there will be the fetal head will go automatically towards the head end of fundus part along with the gravitational force. So to that will relieve the fetal head compression on the umbilical cord. So Trendelenburg position is the best for the cord prolapse patients. So option number B is the right answer. Next one, here in a laboring patient, okay, here the laboring patient is suspected to have a umbilical cord compression. So which among the FHR pattern is most characteristic of complication? So here the examiner is asking you patient came in a labor. So what they will do, came in labor means they will do a CTG. CTG, they'll do a CTG to assess the fetal heart rate. So which among the V1 finding which shows the cord compression. So if we see means there is a two terms, okay, acceleration and deceleration. What do you mean by acceleration? When there is a fetal movement, okay, when there is a fetal movement is there, that time heart rate will be increased. Okay, heart rate will be increased because of fetal activity. What is the deceleration? What do you mean by deceleration? Sorry. If you see pressure and volumes are inversely related. Okay, inversely related. If you see, like this one is a Fan-Starling's law. It indicates if there is an increased uterine pressure, there will be reduced volume. Here, if you see, like when there is an intrant, sorry for the inconvenience. When there is increased pressure means during like a labor process, what will happen? Your uterus will contract to go polarity. What we'll call as polarity. Upside like upper uterine segment will be contracting, lower uterine segment will be relaxing. So when there is uterine contraction, there will be a reduced volume, means reduced blood flow to the baby or a fetus. So what it indicate? Okay, what the isolation indicate? When there is uterine contraction, when there is uterine contraction, because of less blood flow to the baby, there is a reduced heart rate. Okay, there is a reduced heart rate seen. So if you see like umbilical cord compression, already like there is a uterine contraction, there is a normally the blood will fail. If there is a umbilical cord compression, there will be a reduced dropped heart rate will be there. So which kind of dissolution is seen in case of like umbilical cord compression? If you see like variable, okay, variable dissolution is seen in case of umbilical cord compression. Early dissolution is seen in case of normal vaginal delivery when the head, okay, fetal head is compressing the when the fetal head is touching the ground floor muscles of pelvis. So option number B is the right answer. Variable dissolution seen in case of umbilical cord compression. So next question here, 123, woman. Here there is a question. Here there is a question from OBG. Here we are having a woman undergoes for the dilatation and curettage DNC for the presumed miscarriage. Here, histopathological finding reveals there is a GTD. What do you mean GTD? Gestational trophoblastic disease. Trophoblastic proliferation with the avascular chronic villi, and there is no fetal tissue. So, what is the next best step management for done for the case? If you see means normally if there isn't any like malignancy or non-malignancy, any like there is a disease related to the tropov loss, okay, they will abort the baby, they will do a TNC, dilatation and curettage. They will remove the whole tissue and like dead tissue and all they will remove to the dilatation and curettage. So after dilatation and curettage, they will find, okay, on histopathological studies, they will find there isn't some relation of trophoblast tissue is there along with the avascular chronic villi and no fetal tissue is there. So this is a scenario. What they will do, like if like a patient may go for the malignancy in future. So to monitor that one, they will do a beta HCG. Okay, weekly beta HCG level they will going to monitor. If there is more, okay, sudden like a triple amount of beta HCG are present, that indicative of malignancy. So to monitor that malignancy, we are going to perform the beta HCG monitoring morning level with the contraception. So option number B is the right answer. So next question, here we are having 31-year-old woman present with the history of two prior miscarriages and testing shows anti-phospholipid antibodies are present. So what is the most likely the diagnosis? Here the like very easy question. This one is I think so because they already given you antiphospholipid antibodies are present. So it indicating of APLA syndrome. What do you mean by APLA syndrome? APLA syndrome. What do you mean by APLA syndrome? Antiphospho, antiphospholipid antibody syndrome. Okay, antibody syndrome. In this case, what will be there? Like for the semen, for the sperm, there will be a antibodies. Okay, it will the apply antibodies. They will destroy the sperm and the semen on the vaginal wall, and they will prevent. Okay, there will be a increased clotting. Okay, there will be increased clotting and simultaneously bleeding will be there. DIC. Okay, disseminated intravascular coagulation will be there. So there will be a chance of miscarriage will be there in a APLA syndrome. So APLA option by A is the right answer. So moving to next question, we here we having a like a 70-year-old primary gravida came at the 42, okay, 41 weeks of gestation and request for the cesarean delivery. Here the clinician recommends the biophysiological score, okay, BPP. What do you mean by like BPP? To assess the fetal well-being. Which among the following statement is true regarding the BPP as accurately? Here if we see means biophysical score when there is abnormal CTG findings are there, when there is abnormal stress NST is there means that time will tell the patient to go for biophysiological scoring, which will be having more amount of components will be added in a biophysiological scoring. Here it concludes, okay, it includes the fetal tone, fetal breathing, contraction tested, and fetal movement, and the amniotic fluid. Okay, and the amniotic fluid levels will be there. This all are the component of biophysiological scores. Option number C is the right answer. So next question, 126. So here like, this question is from pediatric. Okay, here the newborn present with the midline lumbosacral defect. Okay, midline lumbosacral defect with a protruding sac containing the meninges, nerve tissue. Okay, meninges and nerve tissue both are present through the vertebral defect. What is the most likely the diagnosis? Here the examiner asking you the diagnosis. Very easy question. I think this one with the like meningomyosile is the right answer. Option B is the right answer. Here like, they include meninges plus CSF because sac is there and nerval tissue and nervous tissue. All three are there means we call that one as meningomyelocele. So option B is the right answer. Next question here like what is the earliest sign of increased intracranial pressure in the neonates? In the neonates, okay, this is especially we should target the neonates. Okay, here if you see like what is the early sign? Okay, earliest sign of increased ICP in the neonates. If you see increased ICP in neonates, there will be a anterior fontanelle will be bulged and there will be a projectile vomiting will be there. Projectile vomiting will be there. Diplopia will be there, and blood vision. All three symptoms, okay, all four symptoms are seen in case of raised ICP. But here the examiner asking you neonate and early, okay, earliest sign. You have to target on earliest sign and neonate. If you see neonates, like fluid vomiting, blood vision is all seen in case of other case also like hypopyloric stenosis. That case also you can see the fluid vomiting. But if you see like classical earliest seen, okay, earliest clinical feature seen in case of neonates is setting of eyes. Okay, here if you see means normally eye, this one is a cornea. Okay, this one is eye, this one is cornea. And in infant, what will happen if there is a like, compression of the mid brain? There will be a like the eyelid will go down. Okay, the eyelid will go down. This cornea will go down, and there will be a only white part of eye will be visible because that one has setting of eye sign. Okay, sun setting eye sign. Okay, sun setting eye sign will be seen in case of a raised ICP as a earliest sign. It indicates of there is a compression over the midbrain by the raised ICP. So option by A is the right answer. So next question, in a newborn with a spina bifida meningomyelocele, which clinical sign is most strongly suggests the associated complication? Like option by A, ABC means bulging. Okay, what will happen in spina bifida occulta? There will be obstruction for the CSF flow. Okay, the if you see like normally the CSF will be continuously producing and continuously absorbing. Here, what will happen? Occluda means there is occlusion of CSF flow. If you occlude the CSF flow, there will be a raised ICP. Raised ICP indicative of there is a bulging of fontanelle. Okay, your anterior fontanelle is bulged means will indicative of there is an obstruction for the CSF flow. Option number A is the right answer. Moving to next question. Here we are having a here like a single liner knowledge based question. Here they are asking you viability. Okay, viable period of OM. They are asking you. Okay, what is the lifespan of the OM? Like 12 to 24 hours. Okay, up to 1 day we consider as the like OM lifespan. OM lifespan. It will be fertile. We call that one. Up to 1 day it will be fertile. After that it will go to the like dormant stage. So 12 to 24 is the right answer. Next question will like come from came from pediatrics. Here we're having the child with the child comes to hospital and his chest X-ray reveals there is a boot-shaped heart. Okay, boot-shaped heart present in a sorry, not this one. If this one is a chest X-ray in chest X-ray interpretation from KNO Academy, I told you okay, boot-shaped heart. Okay, boot-shaped heart seen in case of teratology of Fowler TOF. We can able to find the boat shaped heart. Here if you see like the question is indicative, the like a child came to hospital and they taken an X-ray reveals there is a boat shaped heart. What is a clinical, what is a finding indicative of congenital heart disorder? If you see in teratology of Follett, okay, there are four diseases. Okay, four diseases will come in. Disorder comes in the teratology of Follett. In teratology of Follett, you can able to see the boat shaped heart. So option number C is the right answer. So next question, which among the following are the high risk? Okay, are the risk factor for postpartum hemorrhage. Okay, they given you four options. They're asking you, the examiner is asking you, what is the like highest risk for the which among the given patient is high risk for PPH? Here we see twin pregnancy is the right answer. Okay, twin pregnancy, what will happen if there is a two fetus? Okay, two fetus present in a uterine cavity, there will be a more stretched uterus. More stretched uterus means there is a less chance of atony. Okay, means a loss of tonicity of the uterus. So that indicate that clearly like go for a that female go for the postpartum hemorrhage. So twin pregnancy is highest risk for the postpartum hemorrhage. So option number A is the right answer. Next question from pediatric. Okay, here we are having a baby in NICU, which scoring system is commonly used to assess the respiratory failure or severe respiratory distress in a preterm infant. Okay, in a preterm infant, they are asking you the in a preterm infant. If you see like Silverman Anderson score is the used for specially used for preterm babies to assess what? To assess the respiratory distress syndrome, RDS or ARDS or hyaline membrane disorder. If you see like preterm babies, they'll be a like mature. Okay, they are premature or preterm. There'll be a less. Okay, there'll be less amount of surfactant will be present. Okay, there will be less amount of surfactant will be present. That's why they're prone to get a respiratory distress syndrome. To assess that one, we'll use the Silverman Anderson cone. It will include nasal flaring, intercostal chest retraction, grunting, that all indicating like components of your Silverman Anderson score. Okay, Downey score is specimen. Downey score used for term babies to assess respiratory distress syndrome. Okay, so I think so many people will be like confused between the Downey syndrome and Silverman Anderson scale. So option number B is the right answer. If they're asking you for the preterm babies, should always answer it as Silverman Anderson score. If they're asking you for the term babies, you should answer as Downey scale. So option number B is the right answer. So next question. Here we are having a woman in a labor room with the augmented, okay, with the prostaglandins and develops a uterine hyperstimulation. Okay. Here we are having a like woman with a like less than 36 weeks of gestation. Okay, 36 weeks of gestation came to labor room and augmented with the prostaglandin and develops a uterine hyperstimulation. Which among the following drugs used to as an antidote of prostaglandin induce a hyperstimulation. Okay, means here the okay labor has been started early. Okay, preterm labor. Okay, sorry, labor has started early. Okay, labor has started early because of prostaglandin. So to prevent that one, what we are going to use? Okay, to prevent that preterm labor, what we are going to use? Okay, they are asking you what is the analog used. Okay, what is the analog, or you can say we can say like uterine relaxant drug. Okay, uterine relaxant drug. Which drugs will relax the uterine? If you see like normally prostaglandin and analogs will oxytocin analogs will use, prostaglandin analogs will use, and beta agonists will use. Okay, to prevent the hyperstimulation of uterine contraction and all, we'll use the beta agonist. Okay, especially like antidote for oxytocin will use oxytocin. If you see atobisin we use it as an antidote for oxytocin and like beta agonist. Okay, we'll use the beta agonist. Can you name like any beta agonist? Terbutalin. Okay, terbutalin is the drug used as used for the used as beta agonist to prevent the abnormal uterine contraction. So if we see like option, we are having a terbutalin is the beta agonist. So it will relax the uterine cavity. So option number C is the right answer. If you say all among the other options are like negligible, you can eliminate calcium chloride never given. MgSO4, okay, magnesium sulfate given in case of preeclampsia and eclampsia. Hydrolyzine is given for the preeclampsias. So option number C is the right answer. So especially if you see just any exams, if there is a like hyperstimulation or a like a preterm labor is there, means we always give the drugs called as anti-oxidation drugs, beta agonist drug, and the antiprostaglandin drugs are preferred. Next question. Here we are having a 5-year-old child diagnosed with the clubfoot. When the mother asks the possible intervention, which among the following statement is correct? Okay, means as a nursing officer, you are there working in a pediatric ward. The baby is having a clubfoot. Okay, the child is having a clubfoot diagnosed. So the mother will ask, okay, what are the possible intervention for to be done for the clubfoot. So among the which statement you have given will be correct. Here they are asking you which among the surgical treatment or any treatment which correct the clubfoot. Here if you see option B is the right answer. Bracing and casting can be used as a treatment. Okay, this one is a first line treatment. If first line treatment will fail, we will go for the surgical correction. Okay, this one is the second line treatment. So always we should prefer the first line treatment. So option number B is the right answer. Bracing and casting can be used as a treatment for the club foot. So option number B is the right answer. Next question. Okay, next question we are having regarding placenta and chorion. Chorion, which among the following statement is not true? Okay, not true. Here they are asking you which among the following statement regarding a placenta and chorion is not true. Here, if you see, means option number A is the right answer. If you see, clearly indicated. Okay, here the answer is clearly denoting here. Fetal capillaries are direct contact with the maternal blood. Never. Okay, fetal capillaries and maternal blood will never contact with each other because if there is a there will be a placental barrier. Okay, there will be a placental barrier will be there. So that one only will prevent the fetal head and maternal head blood mixing will be there. So fetal capillaries are not in a direct contact with the maternal blood here, but here they given you fetal capillaries are direct contact with the maternal blood. So this one is a not true regarding the placenta and chorion. And if you see rest of remaining options, fetal part of placenta will develop from chorionic fundosum. Okay, that is right. So option number C, if you see the amnion and chorion are fused by the end of the first trimester. Okay, this is also right. Option number D, if you see middle part of placenta will be is called as deciva basalis. It's from the deciva betal. This is also right. So option number B, option number A is a not right. Okay, not true regarding the placenta and chorion. So option number A is a right answer. So I can able to cover the only 135 questions. Okay, I apologize for that one. So I cannot able to find 160 questions. Thank you all for watching it. Okay, keep revising, keep studying for the NORCET time.